Hi, welcome to Unacademy. This is Unacademy Future Doctors, and I am your educator for biochemistry here, Dr. Shivangi Shukla. Let me just check if I'm visible and audible to all of you. Let's check if the stream is running smoothly. Okay, great. So, excuse me. Currently, I'm taking a series called two questions per day series, right? Two QPD series, two questions per day. This is a revision series because that is what I do every month. For the entire month, I teach some part of the syllabus, and then for the last week of the month, I make sure that I take out some time for revision. Okay, because just keeping on reading something over and over again is not going to be of any use if when we have to when we have to put that to use at that time we have forgotten everything. Okay, so it is extremely important that we revise whatever we have read. Okay, now so I have every day I take three such sessions of two questions per day, and each session has two questions, so in total I take six questions per day, and those six questions are from different topics, so we are able to analyze different topics in a retrograde manner. All right. Okay, so you guys would be knowing about Unacademy, the different types of subscriptions for NEET PG, that is Plus as well as Iconic. The Plus subscription will give you access to video lectures from top educators across the country, both live as well as recorded. Also, you get access to printed notes in the PDF format and question banks containing more than 25,000 questions. Okay, the Iconic subscription gives you all of these, the ease to access it while on the go from any device of your choice, and in addition it will also give you access to resources from Prep Ladder. Okay, and do not forget to put in the educator code DRSHUKLA Dr. Shukla to avail an additional 10% discount. In today's times, I would really urge you to try this out, this subscription out, because online education has become the go-to, and it is very essential that you try this out, and for additional discount, this already Unacademy is offering you prices at subscription at very inexpensive prices, and also you can get additional 10% discount, which is a huge amount. So please do not forget to put in the educator code DRSHUKLA Dr. Shukla. Okay, so now I take in each session I'm taking two questions. Okay, now this is the first question, that is you have to answer this in the chat section only. Okay, answer this in the chat section, and look at this, analyze this question carefully, and then answer. Okay, the question is, a molecule with both hydrophilic and hydrophobic faces is called what? All right, is it A, bipathic, B, amphipathic, C, non-polar, or D, bipolar? Okay, a molecule with both hydrophilic and hydrophobic faces is called bipathic, amphipathic, non-polar, or bipolar. Okay, so this is the question. Analyze this. I'm giving you full 5 minutes to analyze this. Okay, and then tell me the answer. Okay, all right. The answer you have to tell you'll have to message that, type that in the chat section. We have discussed this in the chapter of lipids, and also we have discussed this quite a lot of times in enzymes also. Okay, I won't tell you right now, but yeah, we have discussed this quite a lot of times. So I think this is quite a common name. Most of you would have heard of this. Try and answer this in the chat section. Come on, this is not so difficult. Okay, that is why I always tell you to break any difficult word down, especially in biochemistry, to break it down to its Latin roots and then try and understand what it means. Okay, all right. Come on, come on. 4 more minutes. Very good, Prerna. Prerna has answered. Now, is there anyone who wants to contest this? Do the others want to contest this? Masked Doctor has also attempted. Very good. Is there anyone who wants to differ from this answer? They can also put in their answers. Alright, last 2 minutes left. Then we'll discuss the correct answer and the theory behind it, okay? A molecule with both hydrophilic, that is water loving, and hydrophobic, that is repelling water. Okay, last 30 seconds. Anyone who wishes to key in a different answer can do so, or even the same one. Okay, so shall I tell the answer now? The answer is, as Prerna and Masked Doctor have very rightly pointed out, it is amphipathic B. Okay, a molecule with both hydrophilic and hydrophobic faces is called an amphipathic molecule. Alright, now because it has both hydrophilic and hydrophobic faces, so the hydrophilic face is the polar face, okay? And the hydrophobic phase is the non-polar phase. Alright, so in a single molecule you have both polar as well as non-polar ends. Okay, now what is one such molecule that you have heard of during your PMT preparation? Also you have you have read about such a molecule which has both a polar end as well as a non-polar end. What is that? What is that molecule? Come on, that you have read of in PMT. Now I'll tell, when I move it to the next slide, then you'll say that you have, if you look at this hairpin structure with a polar head and a non-polar tail, have you seen such a structure? Have you seen such a molecule anywhere in the PMT, in your during your PMT preparation? Have you seen this? This kind of a structure is, what is this? This hairpin like structure. Haven't you read about the phospholipids, right? The phospholipids have such a kind of a structure, polar head and non-polar tail, isn't it? The phospholipids. Why? Because the lipid part is non-polar and the phosphate group is polar. Okay, so it forms the polar head. And what is the, yes, masked doctor, very good. The non-polar tail is formed by the lipid part, and the phosphate group, which is the additional group, with that forms a complex lipid. Okay, now what is a lipid? Anyone, what is a lipid? Lipid is an ester of fatty acid and alcohol. Okay, an ester of fatty acid and alcohol is lipid. Simple lipid. Now, if you add an additional molecule to it, it will become a complex lipid. Okay, if you add a phosphate group to it or a phosphoric acid group to it, it will become a phospholipid. If you add a carbohydrate moiety to it, it will become a glycolipid. Okay, so depending upon the additional group, the complex lipids are named. All right. Now, these amphipathic molecules, now they have to, if they are present isolated, they can be present like this. But if they have to be present inside the body, what is the main solvent? It is the blood, and that has plasma, which is mainly composed of water. Okay, now water is a polar solvent, isn't it? Water is polar. So this non-polar tail it cannot survive, it cannot be present in water. Okay, then what will happen? The lipids will not be able to not be able to be present in the solution. Okay, now how are they present? They form different conformations. Okay, now one of the conformation is a lipid bilayer, like the cells. Okay, now the cell membrane and the membrane around various organelles is a lipid bilayer. Okay, it is a lipid bilayer membrane. Now what happens is, this is the non-polar tail. Okay, the hairpins are the non-polar tail and the bend is the polar head. Okay, so the polar head, since it is polar, it is going to face the aqueous environment. Okay, both inside the cell, the cytosol, as well as outside the cell, the extracellular matrix. Okay, because both have water. And the inner non-polar tail, that is going to face the non-polar part or the lipid part. Okay, so one way of arrangement of an amphipathic molecule is in a bilayer. Okay, next is in a micelle. Okay, micelle. Now what is a micelle? Micelles are used whenever we wash clothes with detergent. Okay, so what is the detergent? Detergent is an emulsifier. Okay, why? Because what does detergent do? Normally when we wash our clothes with water, the dirt that is present on the clothes, the grease is what? Lipid. Okay, that is non-polar. Okay, it is lipid, it is non-polar. So that lipid cannot interact with water. Okay, now that lipid will not absorb water. So if it is not absorbing water, then it cannot be removed along with water. It cannot be washed away along with water. Okay, so how will that dirt be removed? Then you have to take the help of a micelle. And what is the micelle? Micelle is the detergent is the micelle. It behaves as a micelle. How? This micelle, see, can you see how the amphipathic lipids are arranged in a circular format? So the round polar bodies, the round polar heads, they are facing the water outside. Okay, and inside the circle radially, what is directed? The non-polar tails are directed inside. Okay, now these non-polar tails are enclosing one globule of lipid, the dirt, the grease. So inside this micelle is present a globule of lipid. Okay, which is the grease, the dirt. Understood? And now it can be washed off along with water. Okay, similarly inside the body, micelle is used in the bile salts. Okay, what is the function of bile salts? The bile salts will enclose the lipids, the fats that are to be digested. Okay, and they will emulsify the fats. Okay, what is the function of bile salts? To emulsify the fats. That means the fats have become, the fats which are non-polar, which are hydrophobic, can now interact with water. Why? Because they have been enclosed by the micelle. And what is forming the micelle? Bile salts. Okay. Now the polar head of the bile salt is going to face the water, which contains digestive enzymes, lipases and all, that will digest lipid, and the non-polar tail is going to face the lipid particle. Okay, it is going to enclose the lipid particle. Understood? Now, another very important arrangement of amphipathic lipids is in the form of a liposome. Now, it is like a double micelle, isn't it? Now, inside, what is there? Can you see what the arrangement is? The polar heads are enclosing an aqueous phase inside. Then the non-polar tails have another layer of non-polar tails around, and in between they will enclose a non-polar or a lipid phase, and the outermost polar heads are going to be facing the aqueous phase outside, the aqueous phase out. The structure. Liposomes can be used for targeted deliveries of drugs, used in cancer therapy, gene therapy, okay? And one very important application is amphotericin B. Have you heard of amphotericin B? Last year during the second wave, what was happening was there were increased cases of mucormycosis, and the drug of choice for mucormycosis was amphotericin B. Now, amphotericin B is highly nephrotoxic. Okay, amphotericin B is an antifungal drug, and it is highly nephrotoxic. It is eliminated through the kidneys, and it damages the kidneys. It causes acute renal failure. Okay, so those what happens is, if you enclose the amphotericin B inside a liposome, and that is called a liposomal amphotericin B, then its absorption will be slower and the kidney damage that it does will be minimal. Okay, so amphotericin B is given in a liposomal form. Okay, understood this? Liposomal amphotericin B, that is called. Understanding? Okay, so these are the applications of amphipathic lipids. Okay, this is a polar head, non-polar tail. Lipid bilayer is one of the arrangements present in phospholipids in the cell membrane. Then micelle, we saw how it is utilized, how it is used by the bile salts in emulsification of fats. Next, liposome for targeted drug delivery, gene transfer in cancer therapy, and transdermal delivery of drugs also. Understood this? Got it? Okay, so these are the applications of amphipathic lipids. That means lipids containing both hydrophobic and hydrophilic ends. Next, which of the following will shift the oxyhemoglobin dissociation curve to the left? Okay, is it A, increase in pH, B, increase in 2,3-BPG, C, increase in temperature, or D, increase in partial pressure of carbon dioxide? A, increase in pH, B, increase in 2,3-biphosphoglycerate, C, increase in temperature, or D, increase in the partial pressure of carbon dioxide. Alright, got it? Understood? Shift the oxyhemoglobin dissociation curve to the left. To the left it is asking, okay? Now I'll give you 5 minutes. Think about it. Go back to the curve, try and understand what was the shape of the curve, what was the equation it was representing, what are the different factors which can shift it towards the right, what are the different factors which can shift it towards the left, and then we are going to discuss it, okay? 5 full minutes for you. Come on, guys. Last 2 minutes left. Try and answer. Come on, come on. Last 1 minute left. Okay, Prerna has answered. Very good, Prerna. Last 1 minute for you to answer. Okay, so in just 10 seconds, I'll be telling you the answer. Increase in pH, increase in 2,3 biphosphoglycerate, increase in temperature, or increase in partial pressure of carbon dioxide. Alright. So the correct answer is, as very rightly pointed out by Prerna, it is increase in pH. A option, increase in pH. Okay. Now, what is the shape of the oxyhemoglobin dissociation curve? First of all, tell me. Prerna, tell me, what is the shape of the oxyhemoglobin dissociation curve? What is the name of that shape? The shape of the oxyhemoglobin dissociation curve. What shape is it? Tell me. It represents an equation. The equation is the Hill equation. Okay, Hill equation. And the shape of the curve is, no, Prerna, not hyperbola. It is a sigmoid curve, S-shaped curve. Okay, S-shaped or sigmoid curve. All right, an S-shaped sigmoid curve, and this is how. What does this represent? It represents how hemoglobin gets bound to oxygen. Oxygen gets bound to hemoglobin. Now, one molecule of hemoglobin can bind to 4 molecules of oxygen. Okay, because hemoglobin is a tetramer. It contains 4 heme. One heme can bind to 1 oxygen. One hemoglobin is a tetramer. It contains 4 heme molecules. Therefore, one hemoglobin can bind to 4 oxygen. Okay. Now, one oxygen molecule, as and when it binds to hemoglobin, it will increase the affinity of the hemoglobin for the rest of the 3 oxygen molecules. So, the next oxygen molecule is going to get attached to hemoglobin at lower affinities. Okay, very soon, very quickly. When the second one attaches to hemoglobin, it is going to increase its affinity for the next 2. Okay, then it attaches even more quickly. And after 3 have been attached, the affinity increases for the 4th one many folds. Okay, and this is called cooperative binding. This is due to allosteric effect. Now, each and every hemoglobin molecule is behaving as an allosteric effector to increase the efficiency of hemoglobin in binding to the next oxygen. Okay, this is called cooperative binding, and this cooperative binding is similar to cooperative dissociation also. Like when one oxygen dissociates from hemoglobin at the level of tissues, then the affinity for the rest decreases. The next gets removed, then the affinity for the rest too also decreases. Okay, and then they also get removed faster. So this is how hemoglobin, oxyhemoglobin, deoxyhemoglobin are converted into each other. Now, at high temperatures, at very high temperatures, oxygen cannot stay bound to hemoglobin and it gets dissociated. Okay, so high temperatures will favor dissociation of oxyhemoglobin and therefore the curve will shift towards the right. Curve shifting towards the left means very tightly binding oxygen to hemoglobin. That means increased concentration of oxyhemoglobin. Curve shifting towards right means dissociation of oxygen from hemoglobin, leading to deoxyhemoglobin. So left is oxyhemoglobin, right is deoxyhemoglobin. Okay, remember this. Now, towards the right, first condition we saw how increase in temperature is going to shift this curve towards the right. Next is carbon dioxide. Now, as I have already discussed with you, at the level of tissues, the oxygen is given off from hemoglobin, isn't it? Because this is what the function of hemoglobin is. It is a carrier molecule. It will give off oxygen at the level of tissues because it has to carry oxygen from lungs to the tissues. That is all. Okay, it cannot be tightly attached to oxygen. It has to give it off. Okay, so at the level of tissues, hemoglobin has to give off oxygen. Okay, now at the level of tissues, the partial pressure of carbon dioxide is very high, which will prevent oxygen to stay attached to hemoglobin and therefore oxygen gets detached from hemoglobin. And at the level of lungs, the partial pressure of carbon dioxide is low, therefore it allows oxygen to bind to hemoglobin. Now this is called the Bohr effect. What is the Bohr effect? When at the level of tissues, partial pressure of carbon dioxide is high and it favors dissociation of oxygen from hemoglobin. At the level of lungs, the partial pressure of carbon dioxide is low. It allows association of oxygen to hemoglobin, forming oxyhemoglobin. So, increase in temperature and increase in partial pressure of carbon dioxide is both going to shift the curve towards the deoxy state, that is towards the right. Okay. Next, increase in carbon dioxide means decrease in pH. Why? Because carbon dioxide is acidic. It is an acidic gas. It forms bicarbonate. So, it is an acidic gas. So, increase in pH means alkaline. Increase in pH means alkaline. Alkaline means low carbon dioxide. So, alkaline will shift it towards left. Okay. And acidic, that means decrease in pH, is going to shift it towards the right. Understood? So that is why A is the correct answer. Next, I am going to discuss about 2,3-biphosphoglycerate. Now, 2,3-biphosphoglycerate, how it functions. First of all, just look at this. This is the normal hemoglobin structure. It is a cyclic tetrapyrrole containing iron attached in the center. Now, iron has 6 coordinate linkages. 4 of them it forms with the 4 tetrapyrrole rings, the 4 nitrogens of the tetrapyrrole rings. One, it forms with the his F8 molecule, that is histidine F8 molecule of globin, and one it forms with oxygen. Okay. Now, once this iron attaches to oxygen to form oxyhemoglobin, it pulls the his F8 structure, his F8 molecule also. Now, once this his F8 molecule, histidine F8 molecule is pulled up, which is also attached to iron, then what happens is the chain motion that is transmitted from one molecule to the other, this breaks the ionic linkages in the hemoglobin structure. The ionic linkages are the salt bridges and it will compact the tetramer. Okay, the hemoglobin tetramer will be compacted. The ionic linkages were pulling it apart like this. When they get broken, then it will be compacted like this. So the oxyhemoglobin structure is a compact structure. It does not have much space in between the 4 rings, the 4 chains. Okay, the 4 chains between alpha, beta, beta. It does not have much space between the 4 chains because it is a compact structure. Whereas the taut structure, taut or the deoxy structure is not a compacted structure. It is an open structure. So it is so open that it has space for 2,3-BPG molecule, which is produced from 1,3-biphosphoglycerate at low pressure of oxygen, okay, in the tissues. Whenever oxygen is low, that means whenever carbon dioxide is high, then 2,3-bisphosphoglycerate is formed, okay, and this 2,3-bisphosphoglycerate goes and attaches in between all the 4 chains. So this space is available only in the deoxyhemoglobin part, because the oxyhemoglobin is compacted. So 2,3-bisphosphoglycerate cannot stabilize the oxy part, it can only stabilize the deoxyhemoglobin. Therefore, increase in 2,3-bisphosphoglycerate is going to increase deoxyhemoglobin, it is going to shift the curve towards the right. Okay, understood this? And this is what happens at high altitudes. When at high altitudes you have low pressure of oxygen, there what happens, the 1,3-biphosphoglycerate in glycolysis is converted to 2,3-biphosphoglycerate, and this will stabilize the deoxy form of hemoglobin, and therefore all the oxygen that the hemoglobin has is going to be delivered to the tissues, so that the tissues don't suffer from hypoxia. Understood this? Okay, got it? So this is the idea behind 2,3-biphosphoglycerate. Okay, so we have discussed 2 very important concepts tonight. One was the amphipathic lipid part, and the other is this hemoglobin part. Okay, now we are going to continue in the next session. Okay, alright, you can revise these topics. And if you haven't subscribed to this channel, then do subscribe to it and share this amongst your friends, so that we have even better interaction in the quiz. Okay, bye-bye guys. Thank you.